Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Types of methicillin-resistant staphylococcal aureus. Methicillin-resistant staphylococcal aureus are divided into mainly two types. We have community-acquired methicillin-resistant staphylococcal aureus and also hospital-acquired methicillin-resistant staphylococcal aureus. The community-acquired and hospital-acquired are mainly differentiated by the subtypes. So, community-acquired methicillin-resistant staphylococcal aureus, it is mainly mediated by MAC-A subtype 4. It is mediated by MAC-A subtype 4, and this will possess the this community acquired methicillin resistant is mediated by MAC-A subtype 4, and it will also possess the pontine valentine toxin, and it is important in it causes multi-drug resistance. Whereas we also have hospital acquired methicillin resistant staphylococcus aureus. This hospital acquired methicillin resistant staphylococcal aureus is mediated by this subtype 3. Subtypes 1, 2, 3. 1, 2, 3 are hospital acquired, whereas subtype 4 is community acquired. Whereas hospital acquired is responsible for monodrug resistance. Now, these are the two types of methicillin resistant staphylococcal aureus.
thank you and thank you for watching.